All right, everyone, we're going to go ahead and get started. Good evening to everyone connected from across the country to join the National Association of Latino Healthcare Executives for tonight's topic, The Future of Healthcare, a Digital Platform para Nuestra Comunidad. My name is Christina Arcele. I am the Chair of Social Media and Projects for NALI Tri-State, and it gives me great pleasure to welcome you to our webinar. We have the honor of hosting Mario Anglada, Army veteran, founder, and CEO of HoyRPM, a leader in the field of digital health. Thank you for your time and insight, Mario. Today, we are going to have a conversation on how you and your loved ones can improve your health outcomes by incorporating a digital health platform. If you are new to the NALI family, I'd like to take a few minutes to share with you highlights of our professional association. NALI is an organization with a little over 16 years in the making. Our mission is to promote health equity for Latino communities by increasing Latino and Latina representation within healthcare systems and by supporting policy, legislation, and regulation that seeks to improve health and healthcare for diverse communities. Our vision sets the runway for our future to be the professional association of choice that transforms the Latino and Latina experience in the national healthcare leadership space. We promote and practice authentic leadership, being genuine, self-aware, and transparent. We want you to inspire loyalty and trust. We champion diversity, equity, and inclusion initiatives. We advance various perspectives and ideas, and we strive and work diligently to position you to have a role, a voice, and a seat at the leadership table. The NALI footprint spans across the US via multiple chapters. Our growing member and partner networks represent students, early careerists, mid to senior level executives, physicians, nurses, and other industry professionals that seek to connect and share best practices. We welcome you to connect with NALI and the NALI chapters listed on our website at www.nali.org. We also invite you to think about starting a NALI chapter in your region if one does not exist today. So Mario, before you present about HoyRPM, can you please share your professional trajectory?
Absolutely, thank you, and buenas noches to everybody. So my background prior to founding HoyRPM, I did quite a diverse career in healthcare. I started out in the military, where I was there for about 5 years serving overseas. After that, I went into a management role at Procter & Gamble, where I managed logistics chains and other solutions for them. And before leaving Procter & Gamble, I transitioned over to their pharmaceutical division. So I had a pharmaceutical sales team. I did product launches in the pharmaceutical space and the like. After that, I went over to Johnson & Johnson, where I managed their OTC division. So products like Pepcid, Imodium, Tylenol for the Caribbean and Central America, based out of San Juan, Puerto Rico. After that role, I moved over to the US and started to work specifically in medical devices in a company called GF Health Products in Atlanta. After that role, I moved over to Nestle, where I managed their adult nutrition business for North America, and working with tube feeds, modules, all the nutritional necessities of patients in the hospital and the home and for seniors. After all that, then I went to Univision, the Hispanic media company, and I built at Univision an ecosystem of products and services that address the Latino needs. We built a product at that point in time. It was the only one in the market, which was Univision Farmacia, a discount card. We had about 2.8 million people using it. So during the course of my career, I've always been wondering why we haven't been able to create a solution that is accessible and addressable to the very vulnerable across our societies. And at HoyRPM, what we decided to do was do something about it and create a safety net system that offered you the basics in primary care, a doctor, leading to a prescription, leading to a treatment protocol. And I've been lucky to be able to have done this with an incredible team. I'll share some of them during the presentation, but we tapped into decades of experience in the healthcare field, identifying leaders that we thought could work with us in creating a new pathway for health. And we're glad to share that it's actually working really well right now.
That sounds impressive. We're happy to have you with us this evening, and we would love to hear more about your platform. So I have one question for you. What was the catalyst for the creation of the healthcare digital platform?
It was very simple, and it was during my days at Univision. So I remember we used to do free healthcare screenings, right, across the nation, and you'd see incredible stuff happen there, right? I was one in Phoenix specifically where we were. It was a Saturday morning. It was about 7 in the morning. It was 100 and something degrees. And when I got to the place that we were doing that, I saw that the Latino community was out in droves. We had people around the block. We did healthcare screenings all day long for free. And what I noticed was that we ended up sending a lot of people to the hospital. And that was an eye opener because it actually showed that the community, if you offer them products and services that they can feel are taking care of them, are at low cost, in that case it was free, but low cost works as well, you're able to get them to engage in healthcare. And what I decided to do at that point was to say, hey, if we can bring technology and primary care together and we can deploy that anywhere that you have a 2G cell phone connectivity, we can get healthcare to people. So that was the reason behind it. That event was a catalyst in understanding the need in person. And an event where we screened over a whole day about 1,000 people, we ended up sending 5 or 6 people to the emergency room with incredibly high blood pressures that they had no clue. And they were walking around with potentially life-threatening conditions because they never had access to care. So I decided we're going to do something about it. Let's create a solution that tackles healthcare from cost and from access, and doing it in a bilingual capacity was our starting point.
And what barriers and challenges have you faced since launching your program?
When we started there, we said, let's create a system that system allows us to create safety net solutions, and let's address it from the perspective of going directly to the consumer. That sounds easy, but the reality is one of the biggest challenges for any company is customer acquisition, right? Getting a consumer engaged and understanding of your product and your service is really difficult from a cost perspective. You're going to have to spend a lot of advertising dollars to get them to come to your products and services solutions. So what we did over the course of a couple of years was created very robust partnerships. And when we share the deck, I'll share you, and you'll see how some of these, who they are. But we created a coalition. We went to partners like Verizon Wireless, said, hey, we have the solution that we want to deploy to the Latino community. Could you help? We went to Mayo Clinic. We said the same. They said, yes, we're interested. Let's partner. So we created a coalition of stakeholders in the healthcare space that all had an interest in seeing a company like ours succeed. And we did it through joint efforts, joint ventures, and the ability to create really robust products that address the needs of the Latino community. So the challenge was getting consumers engaged. And what we decided to do was create a lot of very robust partnerships that allowed us to quickly get the volume and the scale that we needed.
And what have you learned from these challenges?
That in order for you to tackle healthcare, it's not going to be you doing it on yourself. That's A, number one, B, 2, C, D, E, F, G.
Right.
It's going to be you and a bunch of other people and a bunch of other organizations. And those organizations and those folks have to have at least commonality of purpose, right? If you're working with somebody and that somebody wants to sell to rich people and you want to work with poor people, there's a misalignment of objectives. But if you have, and you can find those partners that can actually be additive to your mission statement, bringing one of their solutions, one of their skill sets to the table, and commonality of purpose is there, it's a faster and more efficient route than trying to tackle the whole thing on your own. And in healthcare, something as complex as this, it's impossible to do, even if you wanted to do it on your own.
What makes HoyHealth better equipped to improve its members' healthcare outcomes?
Well, we build at third grade education level. And why do we do that? We do that because we wanted to make sure that society has a safety net, right? If you have healthcare, good for you, God bless you. We're happy that you have it. We're probably not a necessity for you. But if you don't have healthcare, and healthcare for 136 million Americans doesn't exist, that's 36% of the population, Latinos being a large chunk of those, it's just, you have to start somewhere. So the challenge is, how do you get them in a holistic environment And how do you get that environment to a level where they can engage with it very simply? That's a challenge that we address. So we took it from a cost perspective. How can we make this accessible to everybody? Because if you're a low-income consumer and you can pay for it, then that naturally makes it accessible to others like health insurance companies, clinics, hospitals, and the like. And that's the approach we followed. We've been able to achieve that. And as you'll see when we present our deck, you'll see some of those products and services, how they come to life.
Okay, I'm hearing a lot of wonderful things. Would you be able to show us or demo your product?
Sure. So I have a deck here, and let me know if you're able to see that as a starting point,
Yes.
and we'll talk about it. So what do? We do 3 things. Those 3 things are focused around a patient engagement in primary care. Primary care is 90% of our medical lives, right? We work in primary care where we need a doctor to lead to a diagnosis, that diagnosis to lead to a treatment. That treatment is, hey, Mario, you have a sore throat, here's your antibiotics, 7 days. Episodic, fairly easy to do. Now, that treatment can also encompass chronic condition management. Mario, you're a hypertensive, you're a diabetic, you're asthmatic. All those relationships are longitudinal relationships. You have to engage with the patient over a very long period of time. So historically, what happens in the primary care space is that there's a lot of fragmentation. This hospital does really cool stuff. This doctor does really cool stuff. This clinic does incredibly cool stuff, but none of them are working in tandem to manage a population or a patient base, right? Because if I go to one doctor and he asks for this test, and I go to a clinic and they ask for this test, I might be replicating everything that I've done, and it's a just fragmented and disjointed system. So we said, let's create the whole ecosystem. So the whole ecosystem, it starts with telemedicine. We give you a doctor. We provide a physician bilingual. We provide them 24/7, and I'll show you how we do that. We also, once that physician engagement happens, we provide you with a medication access program. If you don't have health insurance and you're trying to buy a medication like pantoprazole for your heartburn, no insurance at all, 30 days worth of medication is going to cost you $150. Think about that. If I have to pay $150 to take care of my heartburn, most likely I'm not going to be able to do it. And I'll show you how we can do that for $6. Now, medications and doctors, and then the last portion of that is the ability to monitor a patient, right? What's happening with Mario? Is Mario following the instructions of a doctor? Yes or no? Are the results that are coming back from Mario's test the right ones or wrong ones? Historically, you did not have that in healthcare. You would give a prescription to a patient, you would hope they follow it, and you as a medical professional would wait 6 months or a year, see them back, everything was working well or everything was really bad. What we're working there is on a concept called remote patient monitoring, and some people call it chronic condition management, which we provide tools to a patient, and those patient tools go into the community and we monitor you. Here's an example. This is a spirometer. Blow into it. It'll show me my pulmonary function. Now, when I blow into this, you capture the information, we feed it through a system, we have our doctors monitor, and those doctors will link with your doctor, Christina, if you have one, and that doctor will be then instructed, hey, Christina's doing really well on her spirometry test, but her blood pressure is still elevated. Now the doctor has actionable information that they can act upon. Because a lot of the challenges that you're having with digital health with physicians is listen, Mario, right now I get 1 million alerts. You're going to bring me 5 more alerts. You're going to just drive me crazy. We're saying, no. We're not data dumping on here. We're translating that. We have medical professionals, doctors who monitor everything, and they're going to reach out to you and say, hey, this is what we found. What do you want us to do? So that's the system in a nutshell. Now, what we decided to do was do it English and Spanish to start with, 3rd grade education level. I'll give you examples of that. But what ultimately responded, the market brought us to, is our clients saying, listen, Mario, English and Spanish is awesome. What about Haitian Creole? What about Arabic? What about this? So we're at a point where we now can do this in 19 different languages. And it's built with cultural sensitivity and cultural care as a forefront. If you're a Latino, male, Hispanic, Puerto Rican, we're going to try to match you with that same cohort because the life experience of a Puerto Rican male are vastly different from that of a Mexican male. And understanding those nuances sounds simple, but until you start engaging and understanding how they interact, it's fairly difficult to do. So we try to match on ethnicity, language, and sex. Now, what's the benefits of our programs? Our programs can get patients involved and engaged with their care. It leads to cost efficiencies, accessibility gets improved. it actually starts tackling some big problems that the healthcare system has. So one of the things that we're working on right now is on the 30-day readmission problem, right? When you're a hospital and your Medicare patient goes, if that patient comes out of the hospital and it, for some reason, comes back to that hospital within a 30-day period, that's a penalty. That readmission is not taken care of. And most of the time, that's a function very specifically of the patient going into the community, not following the care plan, and as a byproduct of that inaction, having to be readmitted. So we're working on those. Ultimately, what we are able to do is we're able to capture biometrics. That information comes in, it's structured, it creates a profile. And this is what we talk about when we talk about simplicity, third grade education level, right? So over here, if you can read, great, metformin, 500 milligrams. If you can't, you see colors, and we're going to guide you through it. We're going to say, hey, Mario, tap on the green button, tap on the pink one, tap on the tan one. We engage in that process, and everything is built on a tap system by design because we want, again, to make it really simple. Here's an example of my mobile app. If you're seeing it there, what you're seeing is that it has two big X's and one checkbox, right? Why is that? Because what we did is we created a sequence of events. This patient has to do 5 things. This patient actually did number 3 there first. Why did we book a big check mark? Because what happens is we're going to teach that patient, hey, we got your result. That's awesome. Thank you for the spirometry. But remember, glucometer needed to be first, blood pressure needed to be second. When you start engaging in that level of care and guided care, what patients actually end up doing is becoming really, really compliant because it's a simplified system. You do 3 things every day. You do them in this order. If you have a question, hit on the button. When you hit the button, we're going to answer the phone in your language, and it's going to be your health coach there. So we can do that one tap process. We can deploy this via text message. We get our kits, which are, I'll show you in a minute, deployed to you in the home, in the clinic, in the hospital. And then we help physicians and others manage better patients in the community. Here's how the system works from a flow of information, right? We have on this side, today we have about 19 different devices. So it could be spirometry for your pulmonary function, blood pressure, glucose measurements. It could be temperature, oxygenation, weight scale. So if I'm the typical hypertensive patient, I'm going to get a blood pressure cuff. But if I'm a chronic heart failure patient, I'm going to get a blood pressure cuff and a weight scale because we have to measure modifications in weight for that particular patient, right? Now, all of this feeds into a mobile app that if you have a cell phone, great, we'll download it to you. If you don't, we'll provide you with a cell phone because we want connectivity to happen. Now, that information, once it's stored there, it goes into a system that I'll show you in a minute. And that system then allows us to have medical doctors monitoring and seeing if Mario did the right thing, what was the result? And if that result was great, attaboy, you did well, see you tomorrow. If there was a problem, we're going to engage and say, hey, Mario, what happened? Oh, I forgot how to do it. All right, do you want us to call you during the morning to remind you? That level of support through the ecosystem actually gets consumers engaged really at high levels. As an example, when we engage with patients in the diabetes space, we've been able to show that within a 90-day period, we get these patients into glycemic control 72% of the time. Those are incredibly high numbers. And it's a function of what you're seeing, the simplicity of tapping, 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 the creation of a behavior, that behavior always supported with a really robust back-end support system guiding you through the process. So we can do that for diabetes and glucose control. We can also do that for hypertensive control. And there we're about 51% within 90 days. So really high numbers. Once the information is stored here and analyzed, it's fed through electronic medical records and patient portals. All of these are free to both healthcare professionals and to the patient. So there's zero cost for the software and the technology. And it all lives in a mobile app, right? So what we do now is we take those tools that are in the home and we're deploying them into the hospital, saying, hey, once Mario comes out of the hospital, if he needs an onboarding process to support him through the next 30 days, we're going to do that. So we were able and lucky to acquire a company called Homefront Health. Homefront Health is a company that deploys military medics into the community. So veterans that are educated in the healthcare system that serve as paramedics in the military we're now hiring them, training them, and putting them in the front lines and the last mile into the home. These folks have incredible high skill sets. They're very well trained by the military. But something that a lot of people don't know is that when they come out of the military, because of a highly specialized training, most of them can't find jobs in the civilian world. So we're using a resource there that is highly trained that can be deployed into any situation, and using them as a tip of the spear to go into the home and into the community and assist the members that we engage with there. So that's hospital to home. We're working on that. It's a really exciting space that we're working in. We do telemedicine. So if you're a patient and you need telemedicine, you're going to go to our website and you're going to get a bilingual physician anywhere in the US. This is a little bit dated, so I apologize for that. We're on 50 states already.
Oh,
And
wow.
what's going to happen is that doctor is going to determine, A, can you do telemedicine? If the answer is yes, you're going to have a video conference with that doctor. That doctor is going to be able to prescribe medication within limitations. There are certain limitations, like pain medications can't be prescribed in telemedicine typically. So we're conscious of those limitations, but a doctor, 24 hours, English or Spanish. And if that doctor prescribes medications, we cover over 600 of them in a 30-day supply for that price. So for $79, you get one doctor visit and you get potentially a prescription for 60 days. This cost, when you look at it from the traditional model, if you're going into a primary care setting, you can pay, if you have zero insurance, up to $200 for the visit. And like I described, if you have one prescription for pantoprazole for heartburn, that could be $150. So $350, we've gotten it down to $79. And we think we can make this more effective and more cost effective for people. Here we have an incredible partnership with the National Hispanic Medical Association, 55,000 bilingual physicians across the US. And we're really happy about this solution. This is offered as well to the Verizon members. We have a partnership with Verizon that we can talk about in a minute. So now I got you the doctor, I got you the prescription. I'm sorry, the doctor, the chronic condition management. The prescriptions, there are areas that are still missing in the healthcare system, right? Because if I get a prescription as a patient and I don't have health insurance, what am I going to do with it? So on the one side, we have a discount card called OIMADS. That card covers every FDA approved, branded generic OTC pet medications, funnily, and certain nutritional products. It's available at 65,000 pharmacies. All you have to do is text us the word HOY to the number 474747, and you're going to get a link back with our mobile app. That mobile app, you enter your zip code and you enter the medication, and it's going to give you pricing architecture of all the pharmacies within that zip code. And we give you discounts up to 85%. And I'll show you that in a minute, how it works. The second portion of that is we came up with a concept that we're really, really proud of, which is called OyRx, which is, for the first time, it gives any of us the ability to gift medication to anybody else. So you're in New York, I'm in South Carolina. You call me and you say, hey, Mario, I need help medication-wise, and I need X medication. I can pay for it here. You're going to get a voucher. That voucher, in any pharmacy in the US, you can use it to redeem it at zero payment. So I transmit it to you. It's a payment methodology. You have to have a valid prescription. And I'll show you how that works in a minute. But we said, if that can happen, what else could we do with it? And one interesting aspect is, and you being Latinos all know this, we take care of family members in country of origin. My case, Puerto Rico, others go to Mexico, Guatemala, Honduras, and Salvador. And what we designed was a process that allowed us to do what I just described, but delivering 2 hours later in Mexico. Well, think about you taking care of your grandmother in Mexico and getting delivery of medications within 2 hours in any city in Central America and within 24 hours rurally. So a game-changing proposal for consumers that support family members across different geographies. Our competitive set you see here, well-known brands like Teladoc, GoodRx, and Livongo, they're great, don't get me wrong, but they are one piece of a multi-pronged approach. We have all those pieces put together. We do this in English and Spanish and 19 other languages. Many of them have restrictions in language. We have partnership with federally qualified health centers, insurance companies. We have discount cards. We just won a request for proposal by the American AIDS Foundation, where we're managing HIV patients across the US for them. And we're getting a lot of different corporate clients on a weekly basis into our ecosystem. Some of our partners include the following that you see here. Names that you might recognize is Verizon Wireless. Verizon Wireless, if you remember, Verizon is supporting our solution into the Hispanic community. And you get up to a 35% discount on incredibly low prices to start with as an added benefit for a Verizon member. We're reconfiguring that partnership, and we plan to launch it pretty soon on a nationwide marketing campaign. We have device manufacturing partners down here, electronic medical records, behavioral health, PBMs or pharmacy benefits managers, a couple of those. We have investigation and scientific partners. We have a partnership with ASU and Mayo Clinic, Puerto Rico Diabetes Center, American Heart Association, employer benefits organizations, retailers, clinics, political action groups, and retailers. We have an incredible advisory board, and this is something that we're really proud of because we, by design, went to healthcare experts across the globe and said, could you help us build this? Because hey, good ideas need good execution, right? So a couple of names that I'll call out. Stephanie Bova leads digital innovation at Novartis. She's based out of Switzerland. Joel Dudley was at ICANN. He's now Chief Scientific Officer at Tempus. He's based in Colorado. Brigida Benitez, a partner at Stepto, a privacy policy expert. Innovation lead at AHIP, American Health Insurance Innovation Lab, Shahid Shah. Ron Pion, advisor to Zoom on medical matters. Scott Howell, Chief Medical Officer, former Chief Medical Officer at United Healthcare. Elena Rios, National Hispanic Medical Association President, Mexican population health expert. Joel Sunshine, Chair of Diabetes, used to be Chair of Diabetes at Montefiore. He's now at Tel Aviv University, I believe. David Yates, Business Head for North America for Nestle. And others like Marta Montemayor for Burst and an expert in public relations and communications out of Mexico. So what did we do? We created a team of healthcare experts. My background, you know, but I'd like to talk about the team because the team is incredibly important. So number one, Dr. Hilton Perez. Dr. Hilton Perez has an incredible healthcare background. He's ran federally qualified health centers across the US. He's got a medical degree, 3 subspecialties, a couple of master's degrees. So he's our resident underachiever. And Hilton has built a really, really robust engagement engine. Next to me is Jose Febus, our CTO, expert in design and development. Patrick Todd comes from Nestle and Novartis, where he used to run marketing organizations there. Melissa Pierce comes from WellSpan, where she used to run patient management programs there. Rodrigo Rodriguez, he's Venezuelan, comes from Citibank, where he used to run Latin American programs. Donna Howard from Fresenius, Gene Samuels, PBM expert and lawyer by trade. So luckily for us, we started our journey in 2016. By 2018, we were part of the Startup Health Moonshot. By 2019, Fierce Healthcare selected us as one of the 15 most innovative healthcare companies, which we're really proud of at that point in time. In 19, we also participated in the Tech Diversity Accelerator in Tampa Bay as part of the Tampa Bay Wave. And 2020, we were runner-up to Startup of the Year, which we were really proud of. The company that actually won was a company that provided very low interest loans to the African-American community. So we knew it was going to be really hard to win that, but we are glad to be number 2 there. We're really excited about that. And then in 2021, we were selected by Mayo Clinic and Arizona State University to be part of their tech accelerator. And during that exercise, at the end of the accelerator, we were selected by Mayo clinicians and healthcare business experts as the audience favorite because our mission resonated very, very strongly with their mission set of providing very high quality care anywhere in the world. We do that from a perspective of primary care, and we're building a lot of different projects with the team at Mayo Clinic and Arizona State University. So that's the presentation portion of it. We can do a demo if you want to see that, or I can answer questions. Absolutely. However you guys want.
We can do both. We have plenty of time left.
Great. So do we want to take a question now, or do you want to jump into the demo?
Before I go to the audience questions, I do have one question for you. What would you say to a patient who's hesitant to use your digital platform?
Try it.
Just try it.
Great. If you don't like it, there's no commitment to us. That's one thing, and it's a really important thing that we did. We decided we were going to take a non-subscriptive model to everything we did. right? Because we know, everybody knows the joke, right? You subscribe for something, you forget about it, you get charged every month. We said, let's not get gimmicky. Let's create something that if you like it, you're going to come back. If
Right.
you don't like it, we understand and we appreciate it, and we'll take your feedback, and hopefully next time you'll like it more. But I'll give you examples. So we have this interesting consumer. She is a 67-year-old female from Nicaragua who lives in San Diego. And El Salvador. What she does is that she comes onto our platform and she buys medication and different supplies for her bedridden mom in San Salvador, in El Popo. So this female has seen our solution, and what she's able to do is she's able to, from San Diego, support her mom in El Popo, El Salvador. And that particular consumer, you would think, wow, it's a really interesting dynamic, because you would think that the early adopters to technology are younger, right? That's not what we've seen. This female charges a credit card, and we deliver medications to her mom and other supplies every single month from San Diego all the way into El Salvador, as an example. So we're really excited about where this is going, because when you start seeing what we're doing, we said, listen, we're not going to do subscriptions. We're going to do the lowest cost possible. If we can give it for free, that's ultimately what we would want to do. Right now, when we hit economies of scale start driving down costs. We're going to be able to optimize costs. But right now, I can tell you, when you compare our insulin pricing, as an example, versus GoodRx, our insulin price is 51% cheaper than theirs. And they're a huge company. So imagine our ability to do that once we start generating a lot of transactional revenue on our platform, and we can use that to continually lower costs. So my suggestion is try it. If you like it, great.
Right.
And I'm pretty sure you will. If you don't, give us feedback, and we'll make sure that that feedback is remunerated to you as free services.
I really like that feature where you can pay for your relative's medication, because I personally, I've been in that situation where I had an elder relative who needed something, and I'm thinking, sure, no problem, let me take your card and go down to the pharmacy, and I was absolutely shocked by the price.
Let me show you what we could do in pricing, because that's probably a good next step for us, if you agree with that.
Yeah. Yes.
So I'll show you two products that we have. These are consumer-facing products, but this one is HoyMeds, free discount card. Like I said, you can download it from anywhere on any app store. And what you're doing here, and I'm going to do it in Manhattan, so you see the price differential there, since you're in there. I'm buying pantoprazole in Manhattan. I'm going to search. What the system is going to do is it's going to go out and find in that zip code all the medication costs with discounts to our product. And I'll show you here. So pantoprazole, 40 milligrams, 30 pills, right? At this pharmacy, I'm going to pay $6.84 with the discount. Over here, 13. Over here, 64. Over here, 73. Down here, 82. Why is this really important? Because here, let's use this example. If I go to Rite Aid and I'm paying cash, I'm paying $170. We're giving you 50% discount. You might say, wow, 87 bucks, that's an incredible deal. We agree. It lowers the price there to 82. But we're actually teaching you that even though that sounds like a really good deal, walk a couple of blocks, you get it for $6. So completely free card. Again, all you do is you text the word HOY to 474747, you get it back. And you could use it at 67,000 pharmacies in the US. Now, that's product A. The second product is the one that we talked about, the voucher system, right? So Christina, you're in New York, I'm in South Carolina. I'm going to use you as our demo. I'm going to go here and you're going to call me and you're going to tell me, Mario, I need levothyroxine as an example. I'm going to ask you, Christina, what do you need? And you're going to say, the one I take is 137 micrograms, as you see there. I'm going to click here. I'm going to buy it for you. When I put your email down here, I'm sorry for that, right? And I pay here with a credit card or a debit card, what's going to happen is you're going to get a voucher. And I'm going to show you that voucher in a minute. That voucher is going to allow you to walk into any pharmacy in the US. If you have a valid prescription, you're going to show our voucher. That voucher is then going to look like this. It's a unique number, so there's no fraud. If you need to change it, you can change it before you redeem it. In this scenario, it's metformin, 1,000 milligrams, but if I put your information, it would be the medication that we talked about. with your name, 90-day expiration period, and a big old zero copay. When you present this into the pharmacy, the pharmacist is going to put these data into their system, and they're going to get a message that says valid dispense. So you're going to get your medications with a voucher in any of the pharmacies in the US. And the beauty of our system is that if we can do that for you here, which we can do in all 50 states, we can also do it in all of Latin America. And these are the starting countries. So there, I click Mexico, I put into a shopping cart, I pay, we deliver in 2 hours in any city, within 24 hours in any rural location. And we can do that in Dominican, Honduras, El Salvador, Guatemala. And we're expanding our service offering as we continue to go down the path of development to add more countries, more products, more services. So think about what we just described. For the first time, hopefully you're able to see a complete ecosystem that I have health insurance, great, I could use it. I don't have health insurance. For the first time, I can add a adequate cost, be able to engage with healthcare. And we can do it in, like I said, 19 languages and at a very low cost. So that's what we do in a nutshell. Love to answer any questions that you might have or the audience might have.
I still have a few questions, but let's give the audience a chance. Let me see if I have anything. How do you stay abreast of developments in the medical industry?
So we participate in most conventions, National Hispanic Medical Association. I'm going to Health in Boston, which is a health tech innovation conference. Each of our clinical staff participates in continuing education. They have collaborative agreements with different universities and the like. So we always participate in industry events. We try to maintain ourselves up to speed on latest developments, either in formal or informal education processes.
And how do you select vendors and suppliers? So if we had a manufacturer that was interested in getting onboarded with Oi Health, what would you suggest?
If you have our mission in mind, which is lowest cost possible to the broadest population possible, we'd love to talk to you. So think about the dynamics of what we're trying to do. What we're trying to do is we're trying to bring economies of scale. It's a basic business concept, right? The more widgets I buy, the lower cost the widgets. That's it. Healthcare is the only industry where that doesn't apply. The question is why? The answer is because everybody buys different products, different services, and I have a mix of different goods and services going to a population. But the reality, and this is something that in the industry everybody agrees to, if I have a glucometer and I have 5 glucometers, by definition of an FDA mandate and approval process, they all work the same.
Right.
Basically. So what we're saying is instead of buying 5, let's buy 1, but let's buy millions of these. So that'll allow us to take costs down, and that cost in our model, we always pass it on to the consumer 100% of the time. So if there's partners who are out there who want to work with us, we're glad that they're there. Please reach out. My email is mario@oihealth. So very simple to understand. Send us a note and we'll gladly work with you. On the flip side, there are institutions that actually take our products and take our services and then offer them to their member bases as enhancements of community engagement, as a outreach based on social determinants of health and other areas. So we can partner with you as a vendor, but we could also partner with you as a provider of services. It could be overflow telemedicine if you don't have enough Hispanic or Spanish speaking doctors, sorry. It could be addressing diabetes in the community. We have very robust tools, or any combination thereof. So we love to talk to whomever's interested in partnering with us. We have solutions that we can bring to them, or we can use their solutions as long as our missions are aligned.
I have a couple more questions from the audience. How do you vet your clinicians, and do nurse practitioners and PAs work within your platform as clinicians?
Sure. So how do we vet them is we follow the law of the land, depending where the land is, right? So if we are in New York has a very specific set of standards that qualify a medical professional to practice medicine in New York. We're doing it in Virginia, Mexico, Puerto Rico. So that's the first filter. There has to be a criteria that you're providing primary care solutions, meeting all the regulatory thresholds of the state, country, or wherever you operate. That's one. Second thing that we do is we interview and we select physicians on language, culture, and bedside manner, right? And bedside manner is really important because if you are going to work with the populations that we are going to allow you to work with, we want to make sure that you understand them from a cultural, linguistic, and societal perspective. So we try to find these physicians and we find them and we train them to how to work on our model. And in our model, we work in a servant leadership model. Patient is a patient. We are here to serve the patient. Now, if we're able to do that and we're able to do that consistently in a very effective manner, what we're going to end up having is clinicians that have a high degree of empathy, understand culturally relevant care, and are providing high quality care in a very effective manner. Those three things are ultimately what allow us to bring a lot of physicians into the ecosystem. We are looking to expand to nurse practitioners and other healthcare providers. We started our journey saying primary care is the starting point. We know that there's going to be nurses, dietitians, psychologists, a whole host of others. But what we want to make sure is that we constrain our opportunity to primary care. Because the reality is it's a big enough challenge. Everybody agrees to that. And there are systems today that allow us to create what's called force multipliers, right? If I can get one doctor to have a care team working in conjunction with that physician, I'm probably going to be able to provide better quality care at lower cost in a more effective manner. So we started with physicians, but we're going into all those specialties that you mentioned at some point in time in our not too distant future.
You mentioned psychiatrists. Does OIT Health currently offer mental health services?
Not yet, but that's a recurring request, and we are prioritizing the ability to do that. We know that that's a big challenge in the community.
A couple more questions. Do you offer nutritional support for patients with conditions like diabetes, Crohn's disease, IBD? And how about dietary supplements shown to be beneficial?
Whoever put that question read my email, because we're actually talking to the University of North Carolina to offer exactly that to the population that we address. So on the nutritional aspect of dietetics, yeah, we're working on that, and we have a couple of experts. David Yates, who you saw there, was the North American business head for the Nestle Health Science, the medical nutrition of Nestle. So he's helping us craft some of these solutions. So yes, we're going down that path. On the supplement perspective, we haven't gone there yet because we're tackling one thing at a time, right? We're trying to first get you primary care, then get you tested. Once we get you tested, now we're trying to change behavior slowly. And once we get you there, then the next two steps are, for one, let's start modifying your diet.
Right.
We don't do that, partners do that. And eventually validated supplements that have the ability to engage with consumers that have shown clinically that they are effective. Yeah, we'll definitely bring those to the table.
I have another one. I'm not sure if we touched on this yet, but I'll go ahead and read it anyway. Is an area of focus for your organization in the near future cost price transparency? As long as organizations keep their prices non-transparent to compete in the third-party payer system, healthcare will continue to be unaffordable, affecting mostly communities of color.
I would say yes to all that, with the exception it doesn't only affect communities of color, it affects everybody. So as you saw in our pricing architecture there, I could have shown you a great price and I could have hidden all the other costs associated with it. We did that on purpose because we want to drive transparency. When we work with our partners, we follow a very simplified model. Our margin is around 32%. For those of you that are business background, you know that's typically what Costco does, right? 32% margin on everything. And that's what we operate on. We're operating not on a margin model, we're working on a volume-based model. So with a 30% margin on everything that we do, that's enough for us to be able to scale this adequately. And we don't feel that charging you $100 when we could charge you 10 is something that is ethical, number one. And number two, the population that we address, what we want to make sure is that when they save money, they can use those funds to support their family members. The Latino community has a nuclear family, right? I save, I help others. So the more that we can help people save, the more that we can generate that goodwill within the community. And ultimately, that's a benefit for society, benefit for the patient, benefit for their family. And we get, obviously, we're a for-profit entity. We're going to get benefits there, but it doesn't have to be disproportionate in that fashion. So hopefully I answer that point blank, but yes, we are transparent and we try to be as transparent as we can. In the healthcare system, you have to work within the constraints, right? We can't be advertising the price that we charge this hospital to that hospital. That we can't do, but our mission is to take the price always to the lowest possible denominator.
I think that's it for Q&A. I don't have anything else for you. This has been amazing. Again, we appreciate your time. I thank you for your service as a fellow veteran. Do you have any last parting words or anything that you want to share with the audience?
Come join us. We have a mission here. Listen,
Sign up.
this is an
Download it.
important mission. This mission, listen, the joke that I have with the team is my first meeting 25 years ago in the healthcare phase was access is an issue, cost is an issue.
Right.
My last meeting prior to joining Hoy Health and founding it was access is an issue and cost is an issue. So in 25 years, basically, nothing changed.
Right.
We're actually inflecting the cost curve. So if anybody has ideas of how we can partner with them, if they're interested in learning more about what we do, if they're interested in seeing if there are opportunities to work with us, we would love to do that. This is a mission-driven company, and the mission depends not only on what we think is important, but what the community needs. So the more feedback, the more engagement, the more direction that we're able to gather from those constituents, and it could be everybody in the stakeholder journey. It doesn't have to be the patient and their family. It could be doctors, it could be systems. We're glad to have those discussions, and we look forward to having those if anybody's interested.
Absolutely. Can you give us your email address and that text number one more time?
Absolutely. So my email is Mario, M-A-R-I-O, at HoyHealth, H-O-Y, health.com. And the text number is 474747. And what you're going to send is the word H-O-Y, Hoy, H-O-Y to 474747. You get the mobile app back, and that's one way of reaching us. And send me an email. Love to talk to anybody who's interested and share what we do and share best practices. And if there's benefits that we can bring to the community jointly, would love to do that as well.
Again, thank you so much. With that, we're going to go ahead and wrap up. This will be recorded. It is recorded. It will be posted within the next few days on our LinkedIn profile and the rest of our social media platforms. If you aren't already, please follow Nali Tri-State on LinkedIn. We're on Twitter. We're on Facebook. We're everywhere. And that's it. Thank you for everyone that attended, and have a good night.
Take care.
Bye.
Bye-bye.